Good evening. I'm Mick Raich. I'm the CEO of Vachette Pathology and Stark Medical Auditing. I'm here with my trusty glass of iced tea and some interesting things taking place. It's been a couple weeks since the last video, so let's hit it. First things first, we're getting a lot of questions from labs about the U0005 code for high throughput testing, okay? There's a rule here that the testing must be complete within 2 calendar days of collection for the test to be eligible for the add-on payment. Remember, this is a $75 test with a $25 booster if you get it done within a certain period of time. While some have called this a 48-hour rules, the time frame is actually being measured by calendar days. And CMS clarified that a collection date is day 0. So if the sample was collected on Wednesday morning at 8 a.m., a lab would have until Friday at midnight, basically, 11:59, to complete testing and to be eligible for the add-on payment. If you have questions about this CPT code and how to use this for COVID testing, give us a call. We'll be happy to set up some consultation. Next, some payer issues. Recently, the Medical Association of Georgia is reporting that the Georgia Department of Insurance may be conducting a review of Anthem's conduct within the state. Now, Anthem Blue Cross has had some issues in Georgia, and personally, I've negotiated with them several times there, and it's very, very difficult and very, very interesting. And I can't tell you all the stuff that they resorted to, but I can tell you that it's good that they're getting investigated. I think it's time someone hold their feet to the fire for their actions. Next thing, we had the Medicare Fee Schedule cut that came out in the Federal Register at the end of November, and that cut a lot of CPT codes. But did you know that the COVID relief actually that was passed, the stimulus package, actually added some prices back onto those CPT codes? Yeah, good news. So a lot of times it's 3% per CPT code. So if you want a final view of what it might come out to for pathology and lab, take a look at our website. We put some things out there. Give us a call. We're doing a lot of revenue projections. If you're a new lab and you're trying to figure out how to get paid, and you just found out you're going to get a pay cut on some of these CPT codes, that's going to be interesting. Give us a call. Same with pathology. There's no reason you should go into April wondering what your payments will be from Medicare when you can actually run that calculation and figure it out. We're doing that for about 100 clients right now. Keeps us busy, but it's good stuff. Next, I'm sure you've heard this, Change Healthcare, a big billing firm in healthcare, pathology and lab side, and radiology do a lot of work. Hospitals, they were recently acquired by Anthem, which is tied to UHC. So that explains some things, huh? Interesting angles there. Now, remember a while back, 3 months ago, we talked about hospitals had to be transparent in their pricing. Now, the American Hospital Association is calling on the Health and Human Services to exercise enforcement discretion when ensuring compliance with price transparency rule that took place January 1st. So hospitals are struggling to get money in. They're struggling to buy PPE, get COVID testing. They got to COVID test every patient before they're admitted. And now they have this price transparency thing. What the American Hospital Association is saying, hey, give us a break. We're already getting crushed by all this other stuff. We don't need more compliance rules to follow. Hopefully the Health and Human Services hears that. Here's some more good news. If you didn't apply for the PPP money, the second round of PPP money is out there. And most of our groups applied for it and have already been released. That's a good thing. We feel the next week, I've got some communication from my bank and some other bankers saying the SBA is slowly but surely starting to release this. Each bank will have a portal. You'll fill out an application. We have those applications on our end, by the way. You'll fill out an application, and then you'll have to go to your own bank's portal. So the good news is there's money out there. You're going to compare first, second, or third quarter 19 versus 2020 gross receipts, and they'll pay you 2.5 times your. You have to show a 25% loss in one of those quarters, which I think all providers will, and they'll pay you 2.5 times your monthly income as part of the PPP payment. So that's a good thing. So start working with your accountants, work with us, start calculating this number. It's important. Another thing we noticed today, they came out, the Health and Human Services announced that the public health emergency will be continued for another 90 days, which means this puts us about mid-April. So as long as this public health emergency, certain things are in place and take place, which will change things and make things better. For example, the portal's open for COVID and those type of things. So stay on that. Be aggressive with that. Good things. If you build prostate biopsies, more bad news. We all know how prostate biopsies were here, and then they went way up here, 699% overutilization, and then Medicare changed the CPT codes. You know, UHC, United Healthcare, just came out and said they're requiring a G0416 for all prostate biopsies across all codes. This means that any needle prostate biopsies coded with the 88305 will be denied, which is the same thing Medicare and some of the other payers have already said. Again, article on our website. Heads up, we recently learned UHC also is amending all their fee schedules to be a percentage of 2020 Medicare fee schedule, which isn't a good thing, okay? Many labs and of course many pathology groups have to look at this fee schedule and have to look at these changes as a time to make a change. You cannot continue to take these pay cuts. This is another pay cut. We're going to be starting in February. We're going to do strategy calls with our clients. It's time to renegotiate renegotiate contracts. No longer can you accept a percentage of Medicare because Medicare is going down 3 or 4 or 5 or 9% a year. That's a 9% pay cut. Why the cost of living goes up 3 to 5%? No, we just won't accept it. We're going to have to get aggressive. We're going to have to renegotiate contracts. You know, we're going to have to change our business model to be profitable. And if we don't, it's not pretty. So I know many people think, well, we can't negotiate managed care contracts. They won't play with us. I say BS. There's an angle there. You have to find it. You have to hire a firm like us, which will find that for you. In the last 19 years, we've negotiated over 600 managed care contracts for pathology groups and labs. So it can be done. It's not impossible anymore. You have to find the leverage, and you can find a way to get it done. That's what I have to say. I thank you for giving me a few minutes this afternoon, this night, and chatting, and I hope you have a great day. If you have questions, look at our websites, Vachette Pathology, StarkMedicalAuditing.com. Look us up, give us a call. There'll be a number here, right down there probably, that we'll put in, and just ring me up, and we'll chat, and we'll see if we can fix things for you. Thanks. Take care.